Okay, no disclosures here. We see all these graphic images that scare you, that are used for publicity purposes and marketing. But you can get, obviously, wonderful scars, as one of my patients here. But then when you get one of these situations, I think the situation could be even harder. In fact, this is a patient that came to my office from a local doctor who did FUE on I think a DUPA case that also over-harvested it with prior FUT scars that are multiple in nature. It was a disaster in every level. And I've been doing medical therapy as well as SMP to try to get him to look more decent. So this is really about hype, and I really encourage you not to be an advocate of just selling things to patients, but understanding both sides. And so there's been a huge shift toward FUE, as everyone knows that. Now there's a huge percentage of people doing FUE, and even a certain percentage that do FUE only. I think this data is almost outdated because it's a couple of years old. So are doctors even bothering to learn FUT anymore? Is it an outdated technique? The demand is certainly decreasing, it seems. I did an informal survey, and I had a couple more doctors I asked, but they were after I had submitted this already. And I have actually noticed some increase in FUT requests in my clinic. And I think part of the reason that these patients have said is that there's a lot of online press that are actually negative about FUE, which is shocking because we think about it as being for FUT. And I think because of some of the older FUE grafts and over-harvesting and inexperienced people that shouldn't be doing this, or non-surgeons doing this, have led to actually a backlash on this. So I think part of it is the fact that these really old FUE grafts just were skeletonized with poor survival results. But of course, we get new FUE grafts that are much more comparable to FUT grafts today. So a large part of it is due to new technology, hybrid punches. So if FUE grafts are now approximating FUT in terms of survival, is there anything else we're missing? And these are slides from my friend Ron Shapiro, and he did a wonderful study splitting the scalp both sides. I think you may have heard this before, where very comparable on both sides, but a small selection of patients actually felt that the side with FUE was a little bit thinner, but they didn't see anything. And only until you start getting really close to being shaved do you notice there's a disparity there, where the FUE side is a little less obvious. So his conclusion was that there wasn't much practical difference in terms of the scarring until you got very closely shaved, and of course that's in someone that is experienced doing FUT and FUE. But here's the crux of it. It's two issues, SDA as well as total donor capacity. So the safe donor area, we've heard this from so many people. I think Marcio is so honest to talk about doing a huge session of FUE and wondering is that area going outside of the SDA. So we have to wonder with FUE whether we're violating or approaching that area. So you've already heard from him about FUE and FUT. So we're going to look at total donor capacity. FUT potentially compared to FUE could give you more grafts. And I think that is something that we don't think about. And I oftentimes have patients that look donor depleted, that they're not physically depleted, but I'm close to not being able to harvest more on them through FUE. And I think a lot of the senior FUE surgeons out there would be honest and say there is more of a limit. They approach faster with FUE than FUT, at least in my experience. So when you're starting to look at combining these two, as you heard, if you have more tools in your belt, you have more options. And if you start using FUE in the body or beard, I don't really do a lot of body, I do mainly beard because of the viability and the strength of it for density fills, you can start getting a lot more total donor capacity. And that's really important. These are from Marcio's genius work, so I don't take any credit for any of this. But this is a spectrum we don't talk about. So we show these over-harvesting slides, but let's look at a spectrum. We go from a depletion of the donor supply, which really there's not much more to harvest where you're at that limit, but then it starts to feel thinner, then it looks thinner, then it moth-eaten, and then of course you see these horrific slides that we've heard before with absolute tissue compromise at the extreme end of that. So if you start looking at some case studies that I've done here, you can see the full spectrum of what is available if you can do both FUT and FUE. So this is an FUE for an FUT scar correction. This is an FUE for a traumatic scar for someone who wears his hair short. This is just an FUE for a sort of limited frontal mid-scalp loss. African American males, I generally tend to do more FUE for them. There's a gentleman who wears his hair short, so this is an FUE to do eyebrow and beard transplantation. But when I'm starting to have someone that has a huge degree of loss, my go-to is FUT Mega Session if I can, for preservation of the donor capacity as well as SDA preservation. So that's a sort of a dirty word to think about it, but I will tell you, if you start to truly understand the pros and cons of both, it's important. This is an FUE correction of FUE. Poor angles are mangled, it looks bad, poor donor capacity. This is an FUE correction of someone else's 2 prior FUTs. This is an FUT plus beard FUE to correct bad FUT. This is an FUT plus beard FUE to correct bad plugs and slot corrections. And so if all you have is a hammer, the whole world is a nail. So advantages of FUE is obviously you can wear your hair shorter and have less of an obvious issue with shaved areas, but obviously totally shaved, you're going to see scarring. Psychologically, no incision, faster recovery for athletes can be combined with FUT. Don't forget that these are complementary techniques. So for me, the future of FUT is there because of the better preservation of total donor capacity, preservation of thickness of the donor region, something we don't talk often about, slightly higher graft survival, potentially, no shave needed in simple cases like for females, we overdo things if everything you do is FUE, better SDA preservation, potentially less cost, and can be combined with FUE. So I don't make any money on any of my textbooks or lectures, they all go to charity, but you can see that I'm pretty much split. It's true, I plug my stuff because I'm passionate about this, but I make no money on this. And please come join us in St. Louis next year, July 24th to 25th. Summary is understand the pros and cons of both. Total donor capacity and global thinnings are drawbacks with FUE that should be minded. A great surgeon should have more options in his or her tube belt. FUE cannot solve everything. So really the future of FUT is up to you, not the patient. And join the ABHRS. Thank you.
Thank you.